with you? Okay, great. Well, if we start off, just to confirm, for security reasons, your name and date of birth. Okay. And is your address still the same? Okay. And I assume that means you still have the same primary care doctor. Okay, good. That's very, very simple. So, I have a couple of questions I'll ask you just to do a quick check of a few of the cranial nerves, because I think people can usually tell if something's wrong with a couple of them by themselves. So, have you experienced any unusual taste or smelling sensations, like you smell something and then it smells different to how it should, like you smell an orange and it doesn't smell like an orange, that sort of thing? Okay. And same thing with taste. Have you tasted anything recently that tasted differently to how it normally does? Okay, that's good. And have you felt any numbness anywhere on your body recently? Okay. And have you felt any numbness specifically on your face? Okay. So I'll just do a quick test of the sensation on your face. So if you don't mind now, I will touch your face and I want you to tell me if I'm patting your face or stroking your face, and then we'll move on to, I'll ask you to close your eyes and then I'll touch different parts of your face and I'll ask you to identify the areas that I have touched. So, am I patting or stroking? Good. Am I patting or stroking? Okay, good. Am I patting or stroking? Good. Okay. So I want you to close your eyes and I will touch different parts of your face and you just tell me which part of your face I'm touching. Okay. Close your eyes. Which part of your face am I touching? Good. Which part of your face am I touching? Good. Which part of your face am I touching? Good. Okay, well that's all okay. We'll move on to your ears now. So I'm going to make sound with my hands in your right ear and I want you to tell me right ear and then your left ear, and I want you to tell me if you can tell any difference in the loudness of each ear. Okay? Okay. How was that? You're not sure? Okay, I'll do it one more time. The other one. Okay, so they're both the same. That's good. So now we will, if I can find my instrument, we will check your optic nerve, and what we will do, again, if I can find my medical instrument, there it is I will shine a light at your pupils, and the hope is that they will contract, because the natural reflex of the eye is to close the pupil to let less light in when light is being blasted at it to protect the pupil. So I'll just, on one eye. Okay. Good. And we'll do the other one. So what we're looking for there is your pupil contracting when I flash the light at it like this, and expanding again when I move the light away, and that was completely fine. There's no dysfunction there. So now we'll check the actual muscle movement of the eye. So if you don't mind, just follow this pen for me with your eye. Keep your head straight. Both eyes, I should say. Okay, good. And now allow yourself to become a little cross-eyed. And just stare at it with both eyes as much as you can. I think I'm going a little bit cross-eyed looking at it as well. Okay, that was good. So the next thing we'll do is we will check how your muscles respond in your leg, if you don't mind, to being shaken when they're relaxed, because there are a few different reflexes your leg should have if it's working normally with no nerve dysfunction. So if you don't mind, would you mind lying down for me, and then I will grab your leg, if that's okay with you. Okay, thank you. And I'll just grab your leg here and just let it go really, really limp. Try and relax as much as possible. I know that it's sometimes difficult to relax when someone tells you to relax, so don't put too much pressure on yourself, because we can do this as many times as we need to get a good measure of how your nerves are functioning. Okay, so okay, that's good. And the other one, please. Okay, that was good. So now what we'll do is we will knock your kneecap, and I'm sure that you remember this one because it's a bit uncomfortable. Obviously the natural reflex is for the bottom half of your leg to kick out, and that's what we expect when we hit the knee at a certain point. So I'll just do that knee first and then this knee. Okay. Okay. Okay, good. So that was perfect, and now we will just test the sensations in your leg. So not necessarily the leg muscles themselves, but more the skin of your leg. We're just going to check that you're experiencing everything normally, you're experiencing the right amount of sensation. Now we're going to do this is by using my trusty tuning fork, and I can't lie when I say that I enjoy using this tool. So forgive me if I take some sick pleasure in this part of your neurological exam. I feel like we're close enough now that I can say that to you, and it's not weird. Are you ready? I'm just going to hit this, it's going to buzz, and I'm going to put it on your ankle bone, and I just want you to tell me when it stops buzzing. Firstly, if you can feel it, hopefully you can, and then I'll ask you to tell me when it stops buzzing altogether on your foot. Okay, right, here we go. Okay, good. Okay, that's good. That all seemed normal. So So now we'll do the same with your arms. So pass me this arm, please. Okay. Okay, the reflex there is good. And the other arm, please. Okay. Relax. Okay, good. And we'll do the same tuning fork on your elbow. Are you ready? Okay. So tell me if you can feel it, and then tell me when it stops buzzing. Okay, good. And we'll do this arm now. Good. Okay. So all of that seems completely fine. I'm going to take each of your hands now. I'll do the same with your feet. I forgot to do it before. But I'll take each of your hands, and I just want you to tell me the sensation across your hands when I kind of rub them is the same all the way across, or if there's a difference between one part of the skin and another. Okay. So pass me your hands, please. This hand first. Okay. Nothing. Okay. Anything new there? Okay. Anything new there? Okay. Any new sensation there? Okay, that's good. Now we'll try this hand. So if you pass me your hand, please. Okay, thank you. Anything different to the other hand? No? Okay. Any new sensations? Okay. Any new sensations? Okay, that's all good. So now, just to test the strength you have in your arms and legs, I'm going to ask you to push hard against my hand and with both your hand and later your feet. So if you just push with your right hand. Okay, good, the strength is good there. And do the same with this hand. Yeah, your strength is good there too. And the same with your foot. Okay, yeah, that's good. And again. Okay, good, okay. You're very strong, so I don't think there's anything we need to worry about there. So now I'm just going to scratch you somewhere on your body. Just with my fingernail, and just tell me if you can feel it and where it is. Okay, good. So, your toe, good. Your arm, good. Your calf, good. Okay, I'm not concerned. You don't appear to have any new abnormal sensations. Your sense of smell, your taste, all of that seems to be fine. Is there anything else that you personally are worried about that you'd like me to kind of check on? Okay. What makes you think that a part of your visual field is missing? Okay. So I'll just hold up my hands and you tell me if you can see them. So tell me when you can see my hands. Okay. 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 Well, on a large scale, you don't have any major parts of your visual field missing, so we'll just do fingers, because sometimes if there's just a little part of your visual field missing, you can't pick it up with this test, because that's more entire chunks of your visual field. So tell me when you can see my fingers. Mm-hmm. 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 Okay, so there might be a little something, but it's, as I say, it's not a huge issue. It's not a huge part of your visual field. How long has that been going on for? Well, if you say that it seems to be getting better, then I think we've passed the point of treating it. If it's healing on its own, then we don't really need to intervene. We just need to let your body get on with it, and you should make a decent recovery, as it's only a tiny part of your visual field in the first place. Does that reassure you or not? Okay. Well, other than that, I don't see any new changes, but if you have any issues or you feel paranoid about any new symptoms you might be experiencing, then please let me know, and I will be glad to pick up the phone, talk you through it, and reassure you whatever is happening. And of course, if anything major happens, then you can come in and see us and we'll be here. Okay. Well, it was lovely to see you again. I hope I see you someday outside the clinic. It would be nice to see you in a different context at some point too. So, it was lovely to see you, and I hope I see you not too soon, but soon enough that I get to enjoy the pleasure of your company again. Okay? Okay, well, have a beautiful